Iboan, and a very good evening to all our viewers here on TV1. I'm Dr. Dilshan Fernando, and this is your weekly dose of wellness here on Healthline. First and foremost, I would like to wish all our viewers a very happy new year for the year 2022, and I wish all your health goals to be achieved in this coming year. Having said that, today we are going to be talking about a condition which affects the pediatric population, and once it affects you, it has very long-term, lifelong debilitating effects. To talk about this condition, we have invited to the TV1 studios the first ever consultant, community and developmental pediatrician. She is Dr. Dilini Vipulaguna. A very good evening to you, ma'am, and thank you for joining us here on Healthline.
Very good evening to you. Thank you very much for inviting me.
So, the topic of discussion for today is cerebral palsy. I'm sure most of you have heard of this condition, and if you are living with a child who has developed cerebral palsy, I'm sure you know what kind of struggle it is. So, our objective today is to make our viewers aware of what this condition is, how to try and prevent it and maybe detect it early so that we can reintegrate these patients back into society. So, to start off today's discussion, ma'am, what is cerebral palsy?
So, Dilshan, cerebral palsy is a kind of a group of disorders. We don't see two children with same presentation. And cerebral palsy, we talk that it is a disorder of posture and of course your motor function. So, it's about how you move around mostly, and it causes some sort of activity limitation. And then this happens because there is a insult or some damage to a developing brain. So, while your brain is developing. But when I said that it is a problem of motor or it's a motor disorder, but it's often accompanied by a lot of other complications. So, you could have the disorders in your communication, your eating, your sensation, so like your vision and hearing, and then you will have problems of how you move around and your musculoskeletal problems like hip, your spine. So, it, as you said, it's a long-term condition, and also it affects how you move around as well as how you function in the society.
Definitely. Now, we said it's a motor disorder. For our lay community, it is something to do with your movements and posture, I believe.
Yes.
So, when we talk about cerebral palsy, ma'am, how common is it if you take the global scenario and if you compare how the prevalence is in Sri Lanka? What is the situation as of now?
So, again, to begin with, we don't have our own data as Sri Lanka. So, we are developing our cerebral palsy register. So, globally, it says about 1.5 to 3 to 4 per thousand children would have cerebral palsy. So, this 3 to 4 per thousand would probably be our figure in Sri Lanka as well, because that is what the low middle income or developing countries figures say. So, having said that, in developed countries, actually the prevalence of cerebral palsy now coming down, so which is something we should be headed as well.
Definitely, that is some positive news, and with the awareness of our lay community as well as the development of our medical community as well, our objective is to somehow try and increase our health indices towards the better side and try to avoid conditions like cerebral palsy, which is a debilitating condition. So, now, ma'am, you spoke about the insult or damage to a developing brain. Now, our viewers might be wondering, how does that happen? There might be a variety of ways that can happen. If you can elaborate on how that might happen.
Yeah. So, what I meant by a developing brain is when a child is in mother's tummy. So, from the time you are in the mother's tummy, from about what we call about 3 years, what we usually call, developmental pediatricians call it first 1000 days or golden 1000 days. Okay. So, that is where your brain actually develops very rapidly, and also that is where your brain is making connections. So, that is why we all function today as adults. And if during that period from your intrauterine or when you are in mother's tummy to about 2 to 3 years period, while your brain is developing and while your brain is making connections, there could be so many things that could happen. So, for instance, while during the pregnancy, if mother has some sort of infection, mother had some sort of a medical disease like diabetes or hypertension, that could kind of disturb the blood flow to the fetus, or different things can cause cerebral palsy or the brain damage. And while you are born, during that process of birth, during the labor, you can have a traumatic labor which can cause some degree of reduction in oxygen to your brain. And also if the baby has reduced sugar, so the feeding problems, and then if the baby is jaundice, we call becoming yellow, so within first few days, or if the baby has an infection. And towards later years, what we usually see are again the infections in your brain or the central nervous system, or a trauma. This could be a traumatic or non-accidental injury where child abuse could be a reason, and also something like a stroke. So even babies can have stroke, and this could result in damage in some area of brain, and then you will have cerebral palsy.
Right. Not to alarm our mothers and mothers to be, the medical community is well aware of how to manage these complications, but our message to you is to be aware of what's going on during your pregnancy and after the pregnancy. Like Dr. Dilini just described, the first 1000 days is very important for the developing brain. So be aware of what's going on. Don't delay. If you have any problems that you might need to sort out, visit your either obstetrician or your pediatrician. Make sure that you don't delay. That is what we are trying to convey to you, and trying to convey about this condition so that you know what might happen and what options are available for you. Now, moving forward with our discussion, you said an insult or damage to a developing brain, and is there any way that we can detect it early, and if we do, are there any measures that we can take to prevent any further damage?
Yes. So, the detect it early, which probably is the golden thing you need to remember as parents and clinicians. So, as I said, the brain is developing and making connections during first 3 years. The good thing about it, while you obviously have some damage, because brain is still learning, you can teach the brain to repair that damage. So, for instance, if you catch these children within the time where the brain develops and make connections, actually the science has found the area of brain not meant to do some motor activities also can learn motor activities and do that job in the adult life if you teach that to the brain. So, that is where it is very important that you detect these things early, so you can actually utilize this. We call it brain plasticity. So, brain can adapt and learn. So, you try to use that in your advantage and you try to minimize this damage. So, that is how the early interventions and early detection really works in a favor of child with cerebral palsy. Now, coming back to your question, how you detect these children. So, there are so many ways that you use as developmental or general pediatricians. For parents, probably what I would tell, you all have this what we call the weight book or the CHDR what we call, so the child developmental record book. So, that has certain checklist for each age groups, at least from it starts from 0, so 2 months and up to 5 years. So, that gives you a comprehensive idea what your child should be doing at each age groups. It describes many things, how your child moves, how your child talks, how your child interacts with others. So, the one thing parents can do is look at this checklist. We are actually starting a national program to screen children in the future, but until that happens, the responsibility probably lies with the parents.
Yes.
So, check it with your public health midwife, and if you have any concern at any age point, come back to your pediatrician or come back to your pediatric clinic in the area and then seek the advice. But for cerebral palsy specifically, there are probably, I would say, 3 things. So, I don't want to complicate things, but at least 3 things as a parent or as a clinician you should remember. So, if you see that your child is not able to sit independently by 9 months of age, if your child cannot sit independently by 9 months of age, and if you see any hand preference. So, we say children only develop a hand preference whether you are right handed or left handed by after 1 year. So, after 1 year, but if before 1 year, if you see your child is using one side, and that is a warning sign. So, you never should have a handedness before 1 year of age. And the third thing, when your child walks or when your child bears weight on the feet, is your child tiptoeing? Is the child is not keeping the whole foot on the ground or rather tiptoe? So, these 3 signs, not sitting independently by 9 months, having a handedness before 12 months and having a tiptoe gait are 3 main risk factors we see to predict cerebral palsy. So, if you see these 3, definitely get your opinion from a pediatrician or a clinician and get some help.
Definitely, I think that is some very valuable information coming from Dr. Dilini. If you are a mother to be or if you are a mother of a newborn, you have to keep an eye out on whether they are reaching these developmental milestones. We spoke about the CHDR, the book that you get when you have a newborn, you get it from your midwives or sometimes from the hospital itself. And Dr. Dilini spoke about whether your child can sit independently by 9 months, whether they are showing any hand preference before 1 year of age, and when they are bearing weight, when they are walking, if they have a tiptoeing gait or walking on tiptoes, that is a warning sign for you to immediately seek the advice of your pediatrician. Now, just for completeness sake, maybe I know we spoke with reference to cerebral palsy and these warning signs, but very briefly, if you can just give our viewers an overview of what these developmental milestones that they should achieve very briefly, so that our mothers and mothers to be will be aware of what they should be, what their children should be achieving at each month and maybe years of age.
Okay. So, when you look at child development, you talk about certain different areas, and you look at the gross motor, or what we call how the child moves grossly, and then you talk about the fine motor or the hand activities mostly, and vision, and then you talk about how they communicate. So, how much they understand the language, how much they talk, and then the cognition and the interaction, social, emotional. So, we look at all these areas. So, that is why I said your child book would be the best reference for you, because it covers everything. But as you said, the main things you probably need to remember. So, a child would be keeping their head straight by about 3 months, and they start to roll over. So, I am only giving most motor milestones because we are talking about cerebral palsy today. And by 4 months they start to roll to both sides, and also they start to reach out for things, and then by 6 months they start to sit with some support with a curved back, and they start to grab things with their hand. So, what we call a palmar grasp with the whole hand. And by 9 months they are able to sit independently, and at the same time they started to grab small things with their fingers. We call it pincer grasp. And then, so there are a lot of other things, but I didn't touch upon the communication or the cognitive ones. And then by 10 months they start to crawl. By about 1 year, usually children start to stand up using furniture. They kind of pull up to sit, stand, and then they walk around furniture, and some children would walk by 12 months. But this range could go up to 18 months. So, that is something you need to remember again. So, up to 18 months, we do not consider it is a delay in walking, because the children are variable. So, everybody like adults. So, children can take different time to achieve their milestones, but so walking up to 18 months, we do not consider it a delay, but likewise, so then after 18 months, if your child is not walking again, that probably is something, a concern a parent should have.
Of course, now our mothers should not be alarmed. What we gave is a very general guideline. But if you do feel that your child is not achieving the relevant milestones at the relevant age, it is always pertinent that you seek the advice of your pediatrician. Now, moving on with our discussion, ma'am, when we talk about a condition like cerebral palsy, especially in countries like Sri Lanka, there is a misconception held in society that these children have developed these disabilities due to some problem with the mother, and the mother is stigmatized, which is a very bad tendency that we have, and we are trying to correct that. So, what is your opinion on that?
So, probably the first thing, no parent would ever expect their child to have a problem. So, they will never bear responsibility unless it's a very, very rare occasion of child abuse. So, you know, so nobody is usually responsible for any neurodevelopment or any condition a child is having. So, if what I see when you know people have this kind of misconceptions, so child is a product of both mother and father. So you should not be finding fault when a child is having any sort of a diagnosis, because the family has nothing to do with it. It always comes, certain degree obviously comes through your genetics, but you cannot decide how much it goes, and certain things comes from environment probably that you cannot control. So this is never a problem about your family or who's responsible, but rather what we are going to do from there onwards. By making a parent responsible, you are not having their help to the management, because they play a vital role in managing especially children with chronic conditions like cerebral palsy, because most of our management are family centered. So family is the keystone. So if you don't believe in the family, if you try to find fault with the family, definitely it would be actually the bad outcome for the child.
Exactly, that is something that we want to reiterate here on Healthline. When you are living with a child with disability, it's definitely a combined effort together with the family, your pediatrician, maybe your therapist, or physiotherapist, all together. So rather than apportioning blame to a certain person, it is pertinent that you look forward to how you can reintegrate this child into society and make them a productive person, help them to get their work done by themselves. So that is one reason why we are having discussions like this, to correct these misconceptions held in society. Now, getting back to the topic of cerebral palsy, ma'am, you said it's a group of disorders. So if you can elaborate a bit on what these various types are and what these types entail.
So there are a lot of types depending on how you look at cerebral palsy. So either you can look at cerebral palsy, how it's affected someone. So we call it, you know, bilateral, or all 4 limbs can get affected, or only 2 limbs, only your legs could get affected, or only a side of your limb get affected. So depending on that, you tell, okay, whether it's a hemiplegia where the side of body, or earlier you used to call quadriplegia, but what we now use mostly is bilateral. So both sides are involved. So it could be all 4 limbs or 2 limbs only. And the other types we talk about, the motor type. So when a child is having a cerebral palsy, they have different types of muscle tone. So their muscle tone is affected. So how this muscle tone is affected, we as clinicians we describe. So we talk something about spastic cerebral palsy, and then there is a certain kind where we call dyskinetic, where you would either see dystonia. So children will have intermittently increased tone, and they will have this increased tone when they are trying to do a voluntary activity. So you would see it like that. Or you will have lot of movements like choreoathetoid, or you have problems in your balance, ataxic cerebral palsy, or there could be mixed types. So different types of cerebral palsy could be there, and then you talk about the functional level of the child. So we now have moved forward to a place where we look at the function of people rather than talking about a disorder. So you talk how much they can move. So we use something called gross motor functional classification system to tell how much the child can move. So where you, if the child can move by themselves, you are in a GMFCS level 1 or 2. If the child needs some sort of assistance to move, like a mobility device or a wheelchair, then you tell them they are in GMFCS level 3, 4 or 5. So likewise, there are different ways clinicians look at it, but most probably important for parents are how much in their body it's involved and how much mobility they have.
Now, just to clarify certain things you said, for the better understanding of our viewers, now you said there might be increased tone, meaning that the child would have more rigid movements, is that so?
Yes. So, this is probably something a clinician would assess and see. So, there are when you have cerebral palsy, because it is something happens in your brain, and when your brain is affected, your brain loses certain functions where it controls how our muscles move. Yeah. And because the brain control is lost, the muscles will have increased tone, which we don't have otherwise. So, because of this increased tone, children won't be able to do the desired activity. So, to reach out and grab a ball, they might not be able to do because the tone is too much for them to do that activity. Now, this tone could be consistently increase, where we call it spastic, or it could be variable, that is where we call it dystonic. So, that is basically probably the explanation I can give.
Now, we spoke about the insult or damage to a developing brain, and it can be during the child, the fetal life, or during birth, or up to 1,000 days of life. So, when a child is born, maybe it may look apparently healthy. Now, we spoke about delaying achieving milestones, but what are the other possible clinical features, signs and symptoms that these babies and children might have?
Yeah. So, again, internationally now there is a guideline developed to make sure that you are not missing children with cerebral palsy, like, because traditionally these diagnoses were made when children presented with delayed walking. So, about 2 to 4 years, even probably beyond that, and you have lost your golden opportunity of brain development. So, what we try to do is there would be certain group of children who would have this, what I described earlier. Either the mother had problems during pregnancy, or the baby had problems during the birth. So, like prematurity, they are born too early. So, before 40 weeks of gestation, or they had certain degree of hypoxia during birth. So, they needed the baby room admission, they needed special care, or they had problems after birth, feeding, and then your glucose, your sugar levels went down, or you had jaundice where your baby becomes yellow and needed phototherapy, or they had an infection. So, when you know, okay, this baby's brain probably had some issue because of this insult, then you directly try to get them into what we call a high risk infant follow-up program. So, there are certain neurological assessments and motor assessments developed. So, one is what you said, general movement assessment, and then there is something called Hammersmith infant neurological. So, these are most of standardized assessments, but we use certain motor and neurological assessment, and by about 3 months of age, these assessments are more than 90% predictive of predicting whether the child is going to develop cerebral palsy. So, these are the children who had problems at their birth or perinatal period. Whereas there's another group of children who had not had anything, and then this subsequently go and develop cerebral palsy. Now, how we catch these children, that is where your CHDR is important. You are checking developmental milestones, and that is where the 3 main warning signs I said important. So, like for instance, like in America, they use this as a guidelines for all the pediatricians. Whoever the child presents there, if you see these warning signs, then they directly go into a cerebral palsy diagnostic pathway. Again, you do the same sort of assessments and probably do a neuroimaging, like a brain scan, and then try to make the diagnosis within the first year of life.
Definitely. Now, you might be joining us from an urban area, a suburban area, maybe a rural area, or maybe you might be watching us via YouTube in a developed country as well. But the main message here is, if you had a problematic pregnancy, or if you had a problematic delivery, or if your child is not reaching the required milestones within the required age, then you should definitely follow up with your pediatrician so that we can identify these problems early. By identifying them early, we can get their skills back in order, maybe not to the same level of a normal person, but to reintegrate them back to society. So that is the message time and time again that we want to reiterate here on Healthline. Now, moving on with discussion, ma'am, we know certain conditions have certain tests that we do to diagnose. Now, for cerebral palsy, we spoke about the clinical assessments. Are there any investigations that you might use to further confirm these diagnoses?
Yes. So basically the main thing, as I said, you try to demonstrate that this child has certain degree of insult, or or something has happened in the brain. So that's why a brain scan would be important to demonstrate the suspected damage. But having said that, I need to tell our viewers, probably Sri Lanka being a developing country, most of the high technology, the imaging modalities like MRI would not be available freely for everyone. So there would be very long waiting list. So you might not have MRI scan, then and there as in developed countries. So that is where your clinical examination and assessments are very important. That even without MRI or pending neuroimaging, pending brain scan, you still can start interventions or you start your management keeping in mind that this could be high risk of cerebral palsy. So that's why you never wait for a brain scan, but yes, brain scan help you to make the diagnosis, but it doesn't really delay the interventions.
Definitely, that is very valuable information that Dr. Dilini just conveyed. Now, before we move on to the possible treatments, especially in a country like Sri Lanka with a condition like cerebral palsy, I'm sure you as a community and developmental pediatrician might be coming across certain challenges with regards to treating these patients, because it's like you said, it's a family centered and a multidisciplinary approach. So what are these possible challenges that you might be facing in your day-to-day practice?
So the challenges are many, as you said. The number one probably is coming from our own the clinical community, because the up-to-date knowledge and the new interventions what we have in cerebral palsy is not happening everywhere in the country equally. So there are areas where there won't be any health services for these children, and there would be areas, the tertiary centers are there, and state of art centers are there, and then you have the what you call evidence-based management. So the best management is happening. So that is one problem we come across, the not available services and not enough therapists or staff to deliver these interventions. And then when it comes to the society and family, most of the time our parents or the society, they do not know that such condition exists and how to seek help, or they've been already reassured by the health staff, no, you wait and see rather than doing help. And even when you make the diagnosis, the beliefs in the society and sometimes cultural aspects prevent families until you have a good discussion with them to reach and come out for services. And the infrastructure, so like the financial side of it, because our public transportation is not actually able to accommodate these children. So none of our parents with cerebral palsy really come taking their children in a public transport. They need to have their own, or they need to give their daily wages to give the private vehicle. So there are a lot of challenges when it comes to managing and diagnosing and making sure families stay with us until there is the education when the child goes to school. So this is a lifelong condition, as you said. So each cycle of life, you need to be there always. So these parents as well as the clinicians face lot of challenges because of the factors I mentioned.
Definitely. Now, to move on with our discussion, ma'am, what are the various types of interventions that we can do once we do diagnose these patients? It might vary, of course, with the age that we diagnose them, but what are the various interventions that you as a developmental pediatrician might advocate for them?
Yeah. So there are certain important points probably I need to emphasize. So when we diagnose a child with cerebral palsy, or when we work with child with cerebral palsy, we talk about family centered care. So most of the time the group of clinicians would be just a guide, but the family would be the primary, they would be the therapist actually. So they go home, they do whatever we guide them to do at home. So it's family centered, home based, and when we talk about home, we ask the parents it to be enriched environment. So why it is enriched? If you keep a child in a place where there won't be any opportunities for child to learn, so like certain degree of toys, certain degree of nurture, care, and everything should be there in the environment at home, so that nurturing environment is there. So that is family centered, home based with enriched environment, and we really stress upon early interventions. And as you said, Dilshan, this is a multidisciplinary. So it's not a single person that manages cerebral palsy, it's a group of people, and that is where your different forms of therapy comes. So what each therapy forms mean is physiotherapist is a person who works mostly on your posture, tone, and also your movements. So they work on how the child moves, how you try to minimize the effects of this high tone or abnormal tone. And the occupational therapist is a person who tries to incorporate these same kind of things into how you manage your day-to-day activities, and also about your vision. So like how do you, even if you have abnormal tone or even if you have increased tone, but how do you still manage to eat with a spoon? Whether are you going to try to work on reducing your tone, or you try to make the handle of the spoon different. So that is how the occupational therapist work comes into the picture. And then the speech and language therapists work on the communication side as well as the feeding side. So the communication side is they work on how the child understands the language, as well as, especially if you have cerebral palsy, your muscle tone will actually can affect how you talk. So then you work on how the communication happens, and then whether, again the same thing, your feeding, whether the child has difficulty in swallowing, chewing, whether there is a risk of aspiration. So whether when you eat it just goes into your lung and then you will end up in a pneumonia. So you try to work on these aspects with these three main therapies. But these are the main modalities. While we work as a team, we use the clinicians use medications sometimes, try to help with this tone, or try to help with the feeding problems or regurgitation. So there are different aspects where the medications might be needed depending on each child. So as I said, it could be to manage tone, it could be because a child has seizures or fits, epilepsy. So when you give anti-epileptics to manage, and that is where you again have interdisciplinary, a neurologist might come into the picture. And then you have these children tend to have constipation. So you manage constipation, you manage if they have any regurgitation when they eat, you use medication for these things. And also when the all the therapists comes together and work it's very important to know that everything we tell is not you go home and have a half an hour dedicated therapy sessions. everything we tell to the families or we work on are incorporated into their daily life. So, this is just when the child is being fed, child is being bathed, child is being played. So, these are the activities that parents would do while incorporating into the child's daily life, not as a separate therapy sessions. So, that is why we really need family to work on it, and that is why we encourage it happens at home.
Definitely. Living with a child with cerebral palsy is by no means an easy task, and why we have this discussion, why we want to convey this message is that it's a full-time responsibility. You need to integrate the advice given by your pediatrician and your therapist into the child's day-to-day life, so that we can get their functions back to the best possible level that we can achieve, so that they can integrate back into society. Now, talking about these modalities, ma'am, I noticed that you used the word intervention as opposed to treatment. Now, do these cerebral palsy patients have a definitive 100% cure, or are we trying to get their abilities back to maximal possible level so that they can integrate back into society? Because why I am asking this question is because certain parents, if they don't get quick results, they might be going all over the country, maybe even seeking medical attention elsewhere abroad, trying to get a quick result. So, what is your take on that?
Very good question, Dilshan. So, we are talking about brain here. So, it's very tricky how we work with brain, and knowing that some damage has happened to brain, we definitely can always, what we tell our parents, this is not something like a common cold or probably a diarrhea where you can give a medication and cure the thing. Because we are talking about brain, we are talking about human beings where there's very complex things going on. So, we don't really talk about cure in cerebral palsy, but we rather talk about getting child into the maximum potential. So, the child having maximal potential, families having a good mental well-being and quality of life, while making sure child is having a same good participation in the society. So, there are certain words I use. So, we try to maximize the child's activity level and we try to maximize child's participation in the society. So, these are the goals we try to achieve by doing all these interventions rather than curing it.
Definitely. Now, as I said, living with a child with cerebral palsy in itself is a challenge. Is there any advice that you can give to these parents to make their home environment more conducive and safe for these children?
Yeah, so that again depends on your the child, and most of the time these advices are given by your therapist because each child is different. So, when we call about safety, actually the children with cerebral palsy might not have, they are not very accident prone or something like that, but we try to we give lot of opportunities for them to learn. So, they will learn lot of activities what what the therapist guide or therapist recommend at home environment, because more you do all these activities, more your brain learn, that means more your brain can function as an adult in more functional way. And the second thing, as you said about safety, the second main thing we worry about when a child is having a disability, a risk of child abuse, because the parents go through lot of stressors because of the child having a disability, and also these children gets vulnerable in certain social situations even because of their disability. So, making your child, it could be your home, it could be your school, making your child safe in that aspect as well is very important when you are working or when you have a child with disability, to make sure your child is safe in every aspect.
Definitely, that is something that tends to get overlooked with our parents. With their busy schedules, living with a child with a disability, they are definitely more prone to being abused. We have heard time and time again over mainstream media how these occurrences have happened. So, while living with a child with a disability is a challenge in itself, we urge you as the parents to keep a better lookout for your children's well-being and that is why we want to highlight on this aspect as well. Now, a parent who has a query about their child's developmental milestones and who might have a suspicion, okay, they are not reaching their milestones in the due age, are there certain centers that they can get advice, or is their local hospital the first stop that they should go to?
So, there are different services that could be available to these children. As I said, there is a national program initiated to pick up children early for developmental disabilities, which is run by the public health midwife. So, every child will be screened at certain age groups, and then these children would come through the medical officer health, so MOH, to the community pediatrician. So, this is only happening in the places where community pediatric services are being developed. So, namely it is in Colombo, Gampaha, and will be starting in Kalutara and Galle, and it's running in Kandy district as well. So, these are the kind of limited facilities that is available. But if not, you still have a pediatrician in your area, or there will be a pediatric clinic. So, that if you have a concern, you always can talk to your public health midwife, and you can seek the services of your pediatrician or the pediatric clinic to confirm your concerns. And these pediatric services then will direct you to the required areas, required specialities.
Definitely. Now, with the given time constraints, we are coming towards the end of this program, but before we wind up, like you said, it is a multidisciplinary approach, family based, and we need to get the doctors involved, the therapists, everyone. So, before we wind up, ma'am, what is your message to the parents living with these kids, and also to these young doctors and therapists who are in these maybe rural areas further away from tertiary care centers, or even the young doctors manning these labor rooms even, because it is, like we said, a process that takes place from the intrauterine life to the labor process and then the first 1000 days of life. So, what is your message to all of these groups that we need to get involved in this process?
So, number one, Deshan, probably if we can prevent cerebral palsy, that's the best thing. So, while the mother is pregnant, it's a responsibility not only from the clinician but also of the family of the pregnant lady to make sure your pregnancy is, optimal conditions and you seek help. So, try to prevent these things from happening. And the second thing, obviously, even if you have a problem, seek medical attention early, make sure you are directed to the right services, always seek medical help if you have a concern about your child's development. But if you have a child with cerebral palsy, again don't worry, because these children are, they have their own potential, they can do wonders if they are guided properly and they are gone through their education, they can do everything with right support. So, don't get disheartened, make sure you get to right support, and make sure you get right support for yourselves as well as a family to make sure this life journey is achieved as in a optimal condition. And the other thing I probably would tell to the therapists and our clinicians as well, make sure you are up to date about cerebral palsy, and then you follow the latest international guidelines and you do the proper referrals if you have a concern, and please detect and intervene early, because you can utilize that advantage of brain plasticity and you can achieve a great lengths you can achieve with these early interventions for child with cerebral palsy.
Of course, early detection is the key to either prevent or to nip the cerebral palsy in the bud, and that is a combined effort from the mothers to be to the clinical community, our therapists. So, together as one family we should try and somehow minimize the number of cerebral palsy children, and even if those living with this condition, we should try to get them to their optimal potential to reintegrate them back into society. Having said that, I thank Dr. Dilini Vipulaguna very much for gracing the Healthline studio. It was a very in-depth conversation. I'm sure our viewers got a lot of valuable information. Thank you very much, ma'am, for joining us this evening.
Yeah, welcome, Deshan. Thank you very much for inviting.
So, with that, before we wind up, once again, I wish all our viewers the best for the year 2022. Let's hope that it is a very healthy year for all of us, and let's try to be safe, because still COVID-19 is on the rise, the numbers are on the rise, the different variants are mutating. So, make no mistake, we are still not safe from COVID-19. So, make sure that you follow all the proper respiratory etiquette, hand washing, sanitization. If you still haven't got your booster, make sure that you get it as soon as possible. And with that message, I wind up from this edition of Healthline. Until we meet you again next week with your weekly dose of wellness, I'm Dr. Dilshan Fernando, wishing all our viewers Aibowan.